Hello, and welcome to episode 2 of the Empowered Eating Disorders podcast. We cover topics that may be triggering for some people to listen to, specifically in relation to mental health and eating disorders. If you'd like to know more, please visit our website at www.empowerednw.nhs.uk. That's enough from me, over to the experts.
So welcome back to episode 2 of our Empowered ED Northwest podcast. I'm India and I'll let Georgia introduce herself again.
Hi, I'm Georgia and I'm also a co-host alongside India for the Empowered podcast. And today we have another special guest, Duncan Campbell, who is the clinical lead for the Empowered LPC. Welcome, Duncan.
Hi Georgia, hi India, nice to be here.
So Duncan, do you want to explain to everyone a little bit about your role so people kind of know who you are?
Okay, so I work as, the lead for care for Empowered. Part of my role is working with these guys, with our experts by experience, in delivering some of the things that they want. So training across the Northwest, the experts by experience program. Some of it's looking at referrals that come in for inpatients and trying to see if we're doing the best we can by those people and if we can keep them out of hospital in any way. And some of it's looking at trying to improve care pathways, like in the community, just making things better, really.
Very important role then.
Absolutely.
Yeah, we try.
So I think we should just recap over the last month, as quite a lot has happened. And we did mention last podcast about the penners. Unfortunately, we didn't get all 4, so Dave will not be taking early retirement. But we did manage to win 1 award.
Commissioning for patient experience.
There you go.
And a rosette.
Oh, sorry, can't forget the rosette. So we did win the best networkers. So I think that was quite an achievement as well for the day. But we did have such a good time in Birmingham, and I think my highlight was definitely our car journey there. I don't know about you two.
It was. I think it's safe to say we chatted for the whole time that we were driving there, weren't we, Duncan?
Yeah, it was really good. It's funny, isn't it? Like, we've got all these big expert by experience programs and some really formal things, but some of the informal chats you have are some of the best bits.
Yeah, we definitely put the world to rights in the eating disorder world.
Yeah, it was a bit of a carpool karaoke, I think. If only we'd recorded the journey.
That would have made a great podcast. So what else has happened? So we've had another forum. Georgia, you couldn't attend, so I'll give a bit of a recap. So we just talked about waiting lists and what to do while someone's on a waiting list, and then also the QR code, which someone could have attached to the back of their phone, and it could be scanned if they were admitted to an acute inpatient ward. Duncan, I don't know if you want to say anything more about that.
Yeah, I mean, the idea is just to have something that, so a doctor could scan it on an acute ward and it would just take them to a link, giving them some basic information about eating disorders, links to the community service, that kind of thing. Long term, we want to make sure that, all the acute hospitals really know lots about eating disorders, and people don't need that stuff. But it's a way of, in the short term, making sure that doctors on busy acute hospitals can get information about eating disorders and improve the care they give to people when they go to those, because often people are, they're at their most vulnerable when they're going there. They're frightened, they're worried, and having someone who doesn't know about eating disorders is really difficult.
Absolutely. I think, when a lot of people fall through the gap when they get admitted into, an acute setting in a general hospital, because there isn't that awareness of eating disorders. People can often say the wrong thing,
Yeah.
even symptoms, or even if you're a first time presenting with symptoms of an eating disorder, or even if you are a reoccurring patient, I think it can be a really difficult experience and sometimes traumatic for patients. So I think that would be beneficial in a lot of different ways, but I'm not sure. I think it's kind of getting people to participate in that and having that actually on their phone and kind of letting someone scan that, which we would have to get around, but no, definitely needed.
Well, it's another option, isn't it? I mean, it's something that we hope will be there for people, and if it gives people another choice that they can have, then that's got to be a good thing. Not everyone will use it, but if it's there for some people, it's great.
Definitely.
So what else have we done? We had the Children and Young People's Eating Disorder Workshop, which was held in Liverpool. Duncan, you came along, and we also had another expert by experience, Molly, who did a piece. And that was a really interesting day. We had split off into different groups and were kind of assigned different subjects to talk about. And I felt that a lot of important discussions were had.
Yeah.
Me and Duncan, we sat in different groups, I think. So I'm not sure what the kind of topics were in your group.
Well, I hosted one group in the morning, which was about transitions from kind of young people services to adult services, particularly wards. I mean, we know that's always comes up as an area where things go wrong, information isn't passed on as easily as it should do, and it's not as smooth. So that was really good to talk about. And then in the afternoon, I was in a workshop hearing about whether or not we need a SEDU, a specialist eating disorder unit for young people in kind of Cheshire and Merseyside, and we were talking about that and whether we could get around it by building better community services and daycare, or whether we needed that. So again, really kind of interesting stuff.
Yeah, I think it's a difficult one, isn't it, with the provisions around and the amount of young people that are being transferred out of area to specialist eating disorders inpatient units. The waiting lists are just so long, and people are really struggling. So definitely another important conversation that's been had. I think the group that I was in, we spoke about the implementation of NG feeding in some of our CAMS units. And kind of if there's provisions for that, and also looking at services that already have that, so we're not having to transfer people hours away from home and away from their families. So yeah, that was really interesting.
Yeah, I think the NG feedings it's a really difficult discussion, isn't it? Because it can be so traumatic for people, such a horrible thing, and I guess we all know it needs to happen sometime, but there's got to be ways that we can stop how much it's used or reduce it. There must be ways.
Absolutely.
I think it's also traumatic for the staff involved, like not just the young person or the adult that's receiving the NG feed.
Definitely. I think, and we do support our staff when things like this, need to happen. And I know that staff can have debriefs and they do kind of get a lot of support. But I think if we can avoid doing it, then that's what we want, because we don't want to have to be putting hands on a young person, and we want to be supporting them. And actually, by implementing, an NG feed and kind of a system like that, it ultimately makes it harder for discharge and transitioning, someone outside of hospital and helping them to cope in the community. So no, that was really good. And we also had the celebration event a few weeks ago, which was really, really lovely. I know, India, you kind of attended virtually, and Duncan, you were there as well. But yeah, it was a lovely day. It was nice to have all the experts in one room, to be honest. I know we're all busy and doing different things outside of our role, but it was nice to see everyone have a little chat. And Tim Welch attended, and yeah, it was lovely.
It was really nice seeing something that you guys, some of the experts by experience, families turning up as well, and seeing people, their wider lives rather than just you guys on your own. It was really nice, seeing parents and partners and all sorts.
Yeah, it was nice for Liam to kind of see what I actually do, and I'm not just disappearing off upstairs for a Teams meeting. And so I think he had a better understanding of everything. So that was really nice.
And then we had the Jelly Dance Studio joined us right at the end, didn't we? Which was unexpected and cool. Yeah.
Yeah, they were really good. Like, I wish I could dance, but no, I can't.
We also had Isla Wilson, who's the chair, and then also a few non-executive directors. We had Chris and then also Beverly, the governor, and that was actually her son, wasn't it? That was dancing, which is
Yeah.
mad because I met him a long, long time ago. So it was
Oh, I
weird
didn't
to
know
see.
that.
Yeah, we did DBT together, so
Okay.
yeah, a
Almost
long, long time ago.
lifetime. Yeah.
Yeah, it's
And
mad
then
who you come back into contact
yeah.
with.
Yeah, he's clearly a very talented bloke.
Oh, definitely, and a
Yeah.
great journey for him.
It's nice to see people come out the other side, I think, as well. Like, you know, as professionals, we sit and we see a lot of unwell people and coming in and out of hospitals, and sometimes there are a lot of kind of readmissions and things like that. So it's nice to see someone making it out the other side and, you know, showing others that it does get better.
Well, do you know what? For me, that's one of the things that's kind of the absolute best about the Experts by Experience program. It's not even kind of one of the like the formal aims of it, but in this, because you get to see people in a completely different way. So, you know, we've got, I don't know, people whose works in PR or comms for big companies doing things, and we've got people training as health professionals, or you get to see people doing all the other parts of their life. When you're working as a clinician, you know, you're so focused on the negatives, on looking at the illness and things, and yeah, when you're working with people as experts by experience, you get to see the whole person, and it's great. It just reminds you in lots of ways almost what you're fighting for. You know, why are we trying to do all this work? And it's because actually each of those people has got so many skills and talents and things they can bring, and you really see that in the Experts by Experience program. It's good.
I think that's one thing I loved about, because I didn't realise when I first joined as an expert that you were actually involved, because I think when it was Beat, but obviously you were my therapist for years in eating disorder services, and I was probably a bit of a nightmare. So I think it's nice for people that, you know, helped you along the way see, well, I know for me, see me in a completely different way, achieving now and just not stuck in that rut that I really once was.
Yeah, it is. It's brilliant, and it's, I don't know, maybe it shouldn't be so hard to see that wider person when you're working in the clinical role, but it is hard to keep, you know, keep seeing people as individuals, not just kind of, I don't know, the symptoms on the day and things. So yeah, it's brilliant. Love that part of it.
So that kind of takes us on to what we brought you on as a guest for, I guess. So talking about the roles of experts and your thoughts and whether you think it's beneficial, and do you think other services would benefit from having experts by experience or using lived experience to help better their services?
Yeah, I mean, for me, I've got no doubts about it. I mean, we've talked about some of the slightly informal stuff, you know, that it reminds you of the person constantly, and of the what should we say, the blunt and honest feedback that we can get, not just in long car journeys, but kind of in all sorts of places. But some of that stuff is really important. So, say in eating disorders, one of our biggest problems we have at the moment is that so many people don't use services, or if they do, they only come when things are really, really bad. And at that time, it's, you know, it's much harder to kind of treat things as quickly as we want to. Um, and we know that certain groups of society just don't use services as much as others. As the kind of clinicians, how do you get to find out what needs to change to bring those people in? You know, I can't ask people because they're not in the room with me. And sometimes, I mean, so for me, that's one of the things, like experts by experience know things that we honestly don't know. And honestly, even if we're trying really hard, it's difficult to find out. You guys can talk to us about, I don't know, the barriers to services, what stops people coming, what makes people drop out. And that's kind of really important to improve things. So that's kind of one example of how the experts by experience are changing things for us. You literally know things that that we don't know, and get opinions from people that wouldn't talk to us. So that's one of the starting points for me. And I think both of you would say that. I think apart from your own experience, I think both of you kind of know lots of other people who've had a right range of experiences of eating disorder services, and you're feeding back for them, not just for yourselves. Is that fair?
100%, yeah, 100%.
Yeah.
We see it all, kind of. I think when
So
you've been through so many different services, you meet so many different people, and they've all had different experiences as well. But you can chat to them on a different level than if you were chatting to a clinician, and then we kind of can feed that back to you guys so you can make the changes. But one thing I love is how we are kind of involved in the changes, you know, coming to the clinical delivery groups, the partnership boards, all of those types of things, which I didn't even realise as an expert that we could do, because they seem such serious meetings with, you know, really serious people in them. I don't know what you think, Georgia, but
Yeah.
Tim Welsh, the chair, was saying the other day about you, India, going, "Oi, Tim," across the car park to him.
Georgia told me this. I do not remember. I could never in a million years think of myself saying oi to Tim Welsh.
And that's what I love. We have such a a great, obviously it's a professional relationship, but we feel comfortable and able to raise any issues. And I think I remember the day, sorry, and I think we must have been on our break or something, and I saw Tim like walking across the car park, and we had I think it was something about like future kind of aspirations in terms of nursing and
Yeah.
jobs, or something to do with the Experts by Experience program. And I saw him, and yeah, we just kind of hollered him over. It's nice that we have that relationship, and we feel like we can speak so openly to Tim and other professionals as well, because I think often that there's that disparity between professionals and us, and it feels a lot more kind of level within our LPC. So that's really good.
And I think that's another thing that I guess the program brings. So say I'm a member of the clinical delivery group, which is consultants, team managers, senior professionals from eating disorder services, both kind of community and inpatient across the Northwest. And we have Experts by Experience sitting at that. And again, it just changes the whole kind of tone of some of the conversation if you've got 2 or 3 experts sitting there. So if we're talking about a policy, something quite dry like that, there might be stats involved, there might be research, but then you've got someone who's lived through some of that sitting in the meeting. It just keeps the focus kind of slightly different.
I think it brings it back to being human rather
Yeah.
than statistics and numbers. It's kind of that person-centered rather than system-centered.
Yeah.
I think
Yeah.
naturally we get lost as well, like the service user and the young person. We do try really hard, but sometimes professionals, and I've been there as well, like you get caught up in documentation, policies, procedures, and all these different things that you've got to do. And I think sometimes it's nice to have an expert by experience to just kind of go, hello, I'm here. This is really about someone's life, and the decisions that we make as professionals do have such a massive impact on them, both positive and negative. So it's really nice to be able to feed back not just our views but others as well, and give that chance to people, because often people have had such an awful experience in services, and they don't want to remember it. They get discharged or whatever, and they just think, right, I just want to get on with my life. I don't want to think about all these awful things, which is completely understandable. But at the same time, how are we supposed to get feedback? How are we supposed to know what we are doing wrong or what we are doing right? So, if someone has had a really positive experience, I do really encourage them to say, look, send it in an email, give some feedback, because we want that for all of the people that we support.
Yeah. And I think you're right. And hopefully I guess that's another part of it, isn't it? Is that the input we have from you guys, from the experts, hopefully does stop some of these things going wrong again in the future. Like we mentioned this QR code idea earlier, and that was one of the things we were talking about in the forum. So it takes a doctor in an acute hospital to some information about eating disorders, and and we were asking for experts for their feedback on that, and one of the things it went into was talking a bit about capacity and whether or not someone has capacity and things like that. And straight away, the feedback from our experts was, this information, this idea is brilliant, but it's got to be something that people want to have and want to use, because if people aren't going to carry the sticker and show it to people, it won't have any impact. And that was, you're nodding straight away, India, but that was the feedback. Like, if you have all that stuff about capacity in there, then when someone's frightened and worried, what they're going to read that as is, if you show this, you'll probably get sectioned or something like that. And that's not the intention at all, but that's what people will focus on. So straight away, we've kind of had to take that part out and rewrite it, and we'll bring it back to the experts again. But that's an example of something where, if that idea goes ahead, taking that part out might mean that another 30 or 40 people are willing to use it than if it had been left in. So it's kind of designing things throughout, isn't it, with your opinions of knowing what people are going to focus on, what's going to matter to them.
And we see that, and we sit and reflect. I wasn't part of this meeting, but kind of hearing about it now and kind of the meeting minutes and stuff, if I reflect on when I was unwell, there'd be no chance I'd be sticking a sticker on the back of my phone. I would just kind of want to go in if I had to and kind of blag my way out, I suppose. So but then in the same breath, it is about sitting and thinking, right, but if there are young people that are kind of struggling in recovery or what have you, it would be really beneficial to have something like that, because often, like I said earlier, people have such traumatic experiences in hospital.
I think it's also about making the acute ward staff aware about eating disorders. I think that is the main focus, because they see so many different diagnoses and struggles that they can't know about all of them. But when it comes to eating disorders, it's so specific. You could say one thing and that is it. They're going on, like, that can trigger something for somebody. So I think it's just about the ward staff, about getting that awareness for them, so they know how to talk to the person, and they know how to not deal with them, but interact with them. I think that's more than anything. I think the whole capacity thing, it's a really difficult one, because I knew if there was a chance I would be sectioned, if the word capacity was mentioned, then that's it. I wouldn't be showing them, no matter how much that this would help the award staff understand me better. But yeah, I think it's a work in progress for you, Duncan. Definitely, and it probably will get there.
Well, this is it, isn't it? I mean, this is what we say. We like the blunt feedback, and maybe we'll bring 5 or 10 ideas, and maybe you'll shoot down half of them in flames and say that's a ridiculous idea. But at least we haven't wasted our time going through something that isn't going to be useful, and we can focus our ideas on the things that are. And I think this is what's good about a lot of what we do. We are generating lots of different ideas. We're doing some of the stuff that kind of people in the forum have brought, some of the stuff that clinicians have brought, and then it all comes into this big mishmash melting pot, and some of it gets rejected and some of it goes ahead. But at least we're trying different stuff, like talking to you guys in this shape now. This isn't what the NHS does.
Well, it is now. No, it's brilliant, and I love it's, for me, it's about turning that really horrible time of my life, the amount of years we've struggled, Georgia, and turning all of them struggles into something positive. And so it wasn't it wasn't for nothing, and that to me means a lot. And I think for people in the future, to see them not be treated like maybe we've been treated, or receive better care, then it just makes it all worth it. And I think that's the same for clinicians as well, and even us now as clinicians, if you could call us that. But
it's kind of, I sometimes sit back and I think, maybe even if we just reach a couple of people, I'll be happy with that. And if I'd had something, or kind of had been part of something when I was, really struggling, and I was sat in that hospital room at night, and I was just thinking, there's got to be you didn't feel so alone and unheard. And it's nice to see. It would have been nice to see someone who had been through that, who was going through that, and had come out the other side and saying, you know what, this is okay. It's okay to feel like this. And there are people out there that, do want to help.
Most definitely. And I feel like sometimes I do this for my younger self, and so my younger self can be proud, and my younger self can see the changes that are being made, so I don't feel as hopeless. But definitely I think having lived experience in a team, I feel like is invaluable. I really do, and I'm not just saying that because I do have lived experience in a team, but I have seen like the positives of, like, even Duncan, you've mentioned a lot of positives today that have come out of having lived experience in some of these decisions, and I think other teams should be taking this on board and involving these experiences in their decisions and future for their services.
I think it can be really controversial, can't it? This whole subject of expert experience sometimes, and having service users, because there is a high proportion of people that have been ex-service users that then go on into certain roles within services they have been in before, and it can become really difficult between professionals that might have known them and where is that boundary, because typically you don't cross that boundary between yourself as a professional and your patients, but then having people come back sometimes, it can raise questions of, oh, I knew you when you weren't well, and things like that. So it can become really difficult, but I do think that overall it is extremely positive, and we provide the insight that other people can't. They just simply can't. People can sit in meetings and you can read what it feels like to have an eating disorder, to struggle with your mental health, but unless you've been sat in that hospital room, unless you've kind of had treatment against your will, or really been in that place, you simply do not know. So and that's why I think it's amazing that what we do and working alongside the professionals so closely is why we are really successful as a team.
I'm winning all these awards.
Hey. Yeah, I mean, I think in Empowered we know we're not saying we've got everything right. There's an awful lot that we still need to work on and improve, and we can do that. But I look back to when it started, and I can see changes that have happened. I can see things that will make a real difference to people, not now and for years to come. And you two and the rest of the forum and the experts by experience have, it wouldn't have happened in the way it has without you. There's no doubt about that. So I think if there's doubt about, I don't know, how to make experts by experience going to be as effective as they can. Yeah, I can understand that it can be difficult at times to get it right, but I think that services will only be better if we can get your voices louder. Yeah.
And I definitely feel like my voice is heard now, and I'm sure you do too, Georgia.
Absolutely. Even if we make it heard, but no.
So
it's been
I
great.
think on that note, yeah.
Good.
I'm sure we'll have you again in the future for some more chats and things like that. But yeah, no,
and if not on the podcast, maybe we'll put
on
the
another
worlds to right.
Yeah, maybe another journey somewhere.
Carpool karaoke.
Yeah, but it's been great having you on here, Duncan, because I think you're such a big part of the Empowered team, and I think we all work really well together. But it was great hearing from you, and yeah, thanks for joining us. We hope you've enjoyed talking to us.
Yeah, thanks.
No
It's been
pressure.
good.